Hello and welcome back to another YouTube video. If you don't know already, I'm Laura from Front Office Rocks, and I work from home and it's the holidays. So I thought to give new props and background, I would film in front of my Christmas tree since I don't have that up very often. So you may not be watching this in December, and when you watch this in July, I want you to ho, 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 feel the holiday spirit. I wanted to talk about customer service in this video, but I wanted to talk about customer service when you're dealing with a patient that you're not seeing eye to eye with. Not necessarily a difficult patient, not necessarily one that's irate or mad or anything like that, but just one that you're not communicating well with. And it came up, it was spawned from a issue that happened with me yesterday. I went to the bank and I needed to change some things around with my bank account. And this is something I've never done before. And the banker I was dealing with was not really helping me well. He was using words I didn't understand. It's something I've not done before. And I was trying to ask him to help me, and we just weren't communicating very well. And a couple of things he did frustrated me, and it made the conversation and the communication more difficult. And I thought about, this is kind of some basic things that maybe people aren't taught, so why not bring it up on a YouTube video and talk about it? So my thought is about patients that maybe you're dealing with that for whatever reason, you're having a bad day, they're having a bad day, you're talking about something that's not they're not really clear on, maybe some dental procedures they don't understand, maybe they don't understand insurance, maybe they don't understand why they have to pay, whatever the conversation is, it's not going 100%. How do you handle those conversations? What are some tips or tricks that you can have to help that conversation go along? So the first tip I'm going to give you is exactly what he was doing with me yesterday that just made me mad, and it's the reason for this video, is if a patient doesn't understand fully what you're talking about, if a patient doesn't understand, let's say, in and out of network or deductible or, endodontic procedure or whatever, by continually repeating the word, just saying the words over and over again, just re-saying what you already said doesn't help. If they don't understand what it is you're talking about, try to find different ways to explain it. Try to back up and maybe go into layman's terms, like real easy terminology. Try to use different variations of words. By just repeating yourself, like this banker did to me yesterday, I'm like, yes, I heard you. I got it. I still don't understand what you're talking about. You're just going to make the patient more mad. So if they're not understanding you, maybe it's totally clear to you in your head and it makes sense to you, still back up and try to find different ways to explain whatever it is you're trying to explain. Secondly, not in a rude way, but in a really caring way, maybe ask them what they don't understand. If they're confused, maybe you think they're confused on one thing, but they're actually confused on something else. So when you feel like you've explained whatever it is clearly to them and they're still not getting it, ask them to explain to you what they've heard or what they don't understand or what questions they still have, because you might be assuming they don't understand one thing when really it's another word or another part of your conversation that they're not getting. So actually ask them what they understand and what they don't understand, and try to listen to figure out where the confusion is. The next thing that I would suggest is if it's starting to get frustrating, stressful, whatever the case may be, see if you can take a quick break, excuse yourself. Now, I wouldn't want to leave a patient alone for a very long time, but maybe let them know you're going to step out for a minute because you need to go get some more information to help them understand, or you're going to go get, some more details, or you're going to get everybody a cup of coffee so that we can slow down and have a true conversation. But step away from the situation, the conversation, for just a minute or two, just to give yourself a minute to go, okay, I need to slow down with this patient and I really need to explain what's going on, and to give the patient a moment to maybe process the things that you're talking about, to maybe think through what they've heard, because maybe they just need a minute or two to think about it, and then they're really going to understand what you're talking about. So my next step, like I said, is to just take a quick, time out, let's step away for a minute and let's come back to the discussion. And then lastly, what I would suggest, if it's really still not going great, maybe it's starting to get a little bit like this, see about pulling somebody else in. See about finding another way to go at this conversation. Maybe having a third party, meaning somebody else from your team, the doctor or a clinician, come in to help explain. Maybe allowing somebody else on your team to take over for you. Maybe you're having a bad day. Maybe you and the personality of that patient just don't get along well or not on this topic. So see if you can, tag somebody and have them come in to help you. And or maybe you want to do the same thing with a patient. Maybe they need somebody who can help them. Maybe you reschedule the conversation or the meeting or the conversation and get them to bring in, a sibling or a spouse or a child, somebody that helps them with difficult decisions and discussions. Because maybe you're dealing with somebody who's really in fear or really upset about certain topics like money, or really just don't like to talk about dentistry or whatever the topic is, and they need somebody who they feel is their advocate to be there to help them understand and make decisions. So I'm hoping that, we with customer service always want to make every experience amazing, but not always will you and the patient see eye to eye, fully understand each other. Sometimes there's going to be topics and maybe you don't even know why it's a heated topic or not going super great. Maybe there's some outside factors going on in their lives or something in the office going on that's, you're not doing a really good job explaining it. But make sure that you don't keep trying to push it and push it forward without taking a step back to say, okay, why is this not going well? What am I missing? What communication am I not saying? What is the patient not telling me? Who can I bring in to help with this? Because ultimately, we want to make sure that the patient fully feels heard, fully understands what we're talking about, and make sure that they're making the best decision possible for them. And it's our job to be the bigger person, to be above this and say, what can I do to improve this conversation so it doesn't go south, so it actually turns out to be positive. So there's my tips for, I don't know if I want to say negative or difficult conversations, but ones where it's just not going as well as it could be. Then these are some things that you can do to do your best to improve the conversation. So thank you again for joining us. Please subscribe below and write comments here. If you've got a suggestion of something that you do to help you through a conversation like this, then great. Also ask questions along the way, because I would love to turn this into a conversation, not just at Christmas, but year round. So thank you for joining us. Subscribe below and I will talk to you next time.